Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, let me start first by apologizing for our delayed start of this national briefing. We had an elongated meeting. Bear in mind that by Thursday this week, the extension of the 1 week of the second phase would have lapsed. And we needed to put a lot of things in place before this press briefing. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 3rd August 2020. The Presidential Task Force welcomed all Nigerians back from the Eid al-Kabir celebrations and wishes to express our appreciation to the state governors that put in place the necessary protocols to ensure social distancing and correct wearing of masks during the Eid festivities. The restrictions and the ban placed on the traditional Eid activities like the Daba, which is the traditional horse riding and dances and other activities of mass gathering by the subnational entities also helped in reducing opportunities to further deepen the community spread of the virus. The Presidential Task Force wishes to appreciate our religious leaders, particularly the Sultan of Sokoto, who is the President General of the Supreme Council for Islamic Affairs, and the entirety of the lay clergy and the leadership of the Muslim Ummah for leading the risk communication efforts during the festivity period. We wish to enjoin you not to relent, because the partnership we have formed will go a long way in ensuring that we win this way from the rural areas right up to the urban centers. For our countrymen and women who still harbor skepticism about the existence and the dangers posed by the virus, we urge you to imbibe a change of behavior by complying with the non-pharmaceutical measures prescribed. This appeal remains in our own interests and in the interests of our loved ones. Remember, always wear your mask, observe social distancing, avoid large gatherings, and maintain proper hygiene. Over the 1 week period that PTF could not brief the nation, global numbers have been rising. As at Sunday, 2nd August 2020, the cumulative global cases went up to 18,216,962 cases, while deaths reached 692,280. Let me emphasize that as of July 29th, global cases were around 17 million. But by the 2nd of August 2020, those cases had increased by 1 million, and it took only 4 days for this to occur. Just 4 days, we jumped from 17 million to over 18 million of reported cases globally. 6 months ago, when the World Health Organization declared the novel coronavirus as a public health emergency of international concern, there were no confirmed cases on the continent of Africa 6 months ago. However, as of 2nd August 2020, the cumulative cases in Africa had reached 961,219 confirmed cases, while deaths stood at 20,346. In Nigeria, the number of cases had also gone up to 43,841, while death stood at 888 by the benchmark date. I want to remind us that the global increase in number of confirmed cases of the virus still calls for increased vigilance, committed adherence to protocols, and determination to take personal responsibility. Just before the Salah break, the second phase of the eased lockdown was extended by 1 week. We assured Nigerians that the railway transportation system would be partially open on Wednesday, 29 July, with the commencement of the Abuja-Kaduna rail services. I'm pleased to confirm that that promise has been kept with full compliance with the measures prescribed. Similarly, we informed you about the date that exit examination classes in schools would reopen, preparatory to commencement of examination. I wish to reinstate that the education sector is critical for the development of our children and our nation. Reopening the sector is also a source of concern based on the fact that the school system remains a veritable ground for increasing community transmission if appropriate protocols are not put in place and, more importantly, adhered to. In this regard, the Presidential Task Force wishes to implore stakeholders to ensure that the agreed protocols are put in place and measures strictly adhered to. The Presidential Task Force continues to push forward with community engagement, risk communication, and support to states. There is an ongoing surveillance in the high-burden local government areas just as we ramp up our precision efforts. Similarly, the federal government is supporting the states to firm up their incident action plans preparatory to accessing the World Bank facility for the fight against COVID-19. The national response would continue to guide the adoption of sector-specific guidelines and protocols, just as the PTF is currently concluding discussions with the Independent National Electoral Commission, INEC, on appropriate guidelines to be adopted for elections, beginning with the August 8th by-election in Nasarawa State, to be followed by those of Edo and Ondo States gubernatorial elections in September and October, respectively. I therefore wish to use this opportunity to implore party leaders, aspirants, members, and supporters to remain mindful of the virulent nature of COVID-19 during electioneering campaigns and other election processes. We need to remain alive to enjoy the benefits of our democracy. The Presidential Task Force wishes to thank all Nigerians that continue to respond to call for involvement in the national response. In this regard, we thank His Royal Majesty, the Oni of Ife, for donating 4 motorized modular fumigators, 2 each for the PTF and FCT. In the same vein, we want to appreciate the UN Basket and European Union for delivering the second tranche of PPEs, medical supplies, and equipment. Ladies and gentlemen, As I mentioned during our last press briefing of Monday, 27 July 2020, the Presidential Task Force will submit its 6th interim report to Mr. President. And subject to his approval, we hope to present the way forward to Nigerians at the next briefing on Thursday, 6 August 2020. I'm happy to inform you that as ECOWAS champion on the containment of COVID-19 in the West African sub-region, Mr. President made a donation of 67 million naira worth of PPEs and medical supplies to the government and people of Sao Tome and Principe. In the same vein, hopefully, the goods that were procured by the West African Health Organization and brought in to the hub in Abuja here, we would start with the support of the Nigerian Air Force under the instructions of the President, start the distribution of these items on Wednesday to the different West African countries. We would further give you details in respect of that, and we would urge you to cover extensively the distribution of these items to our sister West African countries within the ECOWAS sub-region. Mr. President's leadership of this regional effort will be more impactful if Nigerians demonstrate that our national response could be replicated in other West African countries by first changing our behavior and complying with the non-pharmaceutical measures put in place. The Presidential Task Force wishes to use this opportunity to appreciate the group of survivors that have added their voices to the campaign against stigmatization and urge the rest of us to always remember that COVID-19 is not a death sentence, and we need to be supportive of one another. Most importantly, let's wear our mask properly, stay at home, especially for those above the age of 60 years, maintain social distancing, and continue to take personal responsibility while we encourage others to do the same. I now have the singular honor to invite the Honorable Minister of Health, followed by the DIG Nigerian Center for Disease Control and the National Coordinator, to brief you and give you updates as it relates to their functions. I thank you all for listening.
Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19 Response and Secretary to the Government of the Federation, honorable ministers, permanent secretaries, the National Coordinator, Director General, ladies and gentlemen. I join the Secretary to the Government in welcoming all citizens back from the Salah break, and I hope it served as well a period of celebration and thanksgiving as it must have done for some reflection, which under the prevailing circumstances cannot but dwell on the greatest public health challenge of our generation, the COVID-19 pandemic, and the adverse effect and impact it has had on societal and economic life in our country and also globally. As the cause of this disease becomes a little clearer, experts are hazarding cautious guesses. The Director General of the World Health Organization has advised, for example, that COVID-19 could be with us for a long time. This means that we are all to consider adjusting to what has been described as the new normal, a way of life that is intended to reduce risk of infection while allowing meaningful economic life to resume and for citizens to restore their livelihoods. This will mean that there will be more movement, more traveling, and also more commerce and activities. We must not lose our bearings in spite of all of that. All members of the Presidential Task Force are aligned in the key role of non-pharmaceutical interventions in controlling new infections, especially as the economic space begins to open up. Because the measures are easy, they are cheap, and they are proven to be effective, and especially the wearing of masks, avoiding crowds, washing hands, using sanitizers. I urge all citizens, in spite of going about their activities, not to slacken in their adherence to these important measures. We in the health sector are key actors in the health-related parts of our response. Our objective is to reduce case fatalities to less than 1% from the present just over 2%. And we are working on innovative interventions with prospects of improving survival chances, especially for the elderly and those with comorbidities. We shall work with state governments to prepare the necessary space and human resources at general hospitals or primary healthcare centers for the human resources to be trained for setting up at least one sample collection site at every local government area in due course, with efficient sample retrieval logistics to convey samples to laboratories. This is ambitious, but we must have concern that COVID will also spread to small towns and to rural areas, and prepare ourselves for that. For patients with significant clinical symptoms, we also plan the designation of holding rooms at general hospitals so that patients are not rejected. Simple holding rooms with facilities for oxygen administration, particularly for those who come in distress. We require things like oxygen concentrators or even oxygen cylinders. Some investment in this strategy, which is already in use in Lagos State and known as oxygen kiosks, will be required, but the benefit in lives saved will be significant. With regard to the COVID-19 scene in Nigeria, today, Monday, the 3rd of August, we have on record 43,841 confirmed cases out of a total of 286,091 samples tested so far, while 20,308 persons have been treated successfully and discharged. 888 persons have sadly been lost as a result of COVID-19. No meaning can be read into this as yet. It is too early. But in a month-to-month comparison, the total number of COVID-19 positive cases recorded in July was 17,457 out of a total test sample done of 154,454 tests, with a positivity rate of 11.3, while in June 2020, the figures were 19,149 positive cases from a total of 111,052 samples tested and a positivity rate of 17.2, Again, it is too early to draw conclusions, but it is noteworthy that the testing increased by over 40,000 in that 1 month from June to July, while the number of positive cases dropped by more than 2,000. We must not rest on our oars, and what we see is just suggestive of the fact that at least our strategy is not failing. We must continue to sustain our efforts. I wish to assure our health workers that there should be no anxiety about personal protective equipment, as we are reasonably well stocked with materials and commodities which have been supplied to all sections of the country. And at the directive of His Excellency the President, as we just heard, we were also in fact able to respond to the request of a neighboring country of Sao Tome for commodities for their own COVID-19 response and to send a consignment to a sister country requiring support. I also wish to assure our citizens that we are continuing to increase and optimize laboratory diagnostic capacity, most recently in Zamfara, Kebbi, Yobe, Taraba, Gombe, and Bayelsa states. On behalf of the government and people of Nigeria, I once again here express appreciation to the United Nations systems in Nigeria, made up of several groups, including the World Health Organization, here represented by the African Nigeria representative, country representative, and also to the European Union for their generous donation of yet another consignment of valuable supplies, which I had the privilege of receiving at the airport on Friday, the 31st of July, 2020. This additional delivery will boost our stockpile of wherewithal to fight the pandemic, and it includes face masks, shields, goggles, airways, tubes, biohazard bags, safety boxes, test kits, etc. I want to assure our donors and partners that all of these materials will be put into judicious use in fighting COVID-19. On another note, Nigeria joins the rest of the world this week to celebrate World Breastfeeding Week, marked annually from the 1st to the 7th of August, to create awareness of the importance and value of breastfeeding. The theme of this year's celebration is Breastfeeding for a Healthier Planet. This is a good opportunity to emphasize it at this time when the world is threatened by this pandemic, of the need to nourish infants properly. I encourage all mothers to continue the practice. The Honourable Minister of Women's Affairs and I will hold a joint press briefing tomorrow as part of the activities of that day. I thank you all for your attention.
Chair and Secretary to the Government of the Federation, Honorable Ministers, Permanent Secretaries, colleagues, gentlemen of the press. Today I thought to update you a bit on a very topical issue globally on vaccination prospects and what is going on generally. We're all aware that there's been a constant increase in cases, and even in countries that initially thought they had this under control, we're seeing some increase in transmission of COVID-19 in many countries in Europe. In Kenya, they've just extended their curfew to July 27, or they extended their curfew on July 27, and banned the sale of alcohol in restaurants following a steep increase in cases of coronavirus across the country, especially in the capital, Nairobi. The reality is that despite several interventions, that we're still facing a global public health crisis that is unprecedented in our times. And of all the innovations known to medicine, the biggest hope that we have to get this outbreak under control is a vaccine. Vaccine is by far the most important medical intervention, any medical tool known in history. Has prevented more deaths, saved more lives than any other single intervention, be it a medicine, a drug, any type of surgery. Nothing has saved more lives than vaccines. This has been the mainstay of interventions against many infectious diseases from polio to measles, mumps, tetanus, and has led to one of the biggest victories that we know in medicine, the eradication of smallpox, and hopefully soon the eradication of polio. So for COVID-19, there's no doubt that we need a safe, effective vaccine to halt the spread of this virus. And this is really the focus of the scientific community around the world. So where are we now? Normally, vaccine development takes anywhere between 10 to 20 years. But yet, we have made incredible progress in the last 6 months. The most recognized vaccine tracker by the London School of Hygiene and Tropical Medicine shows that there are about 226 vaccine candidates right now at different stages of development. So far, preclinical and early data is encouraging. Early data has shown that some of the vaccines that are going through these trials are well tolerated among volunteers, which is the first thing you do. But we still do not know how it works in large populations, how effective it is in large populations. So right now, there are about 5 candidates that are in phase 2 to 3 trials, which is really when you try the vaccines among larger groups of people, up to 30,000 people. The data that we have so far is they're safe, from what we know. The data on efficacy, i.e., do they work or not, the earliest data that we know about will be available by the 4th quarter of this year. Not every country carrying out these trials is as open and transparent with their data, but for those that are, we expect early results in the 4th quarter of this year. So what does this mean for Nigeria? Now, the biggest difference between this outbreak and the Ebola outbreak in 2014 and 15, one of the biggest differences is the emergence of a few significant institutions. One is the Africa Center for Disease Control that is doing the thinking and intervening on issues relating to health security on a Pan-African basis. The second is something called the Coalition for Epidemic Preparedness Innovations, called CEPI. Both organizations were formed after the Ebola outbreak in recognition that you have to bring countries together to work towards coordinating equitable access for vaccines. Africa CDC is now leading and coordinating our region's involvement in vaccine research, development, manufacturing, clinical trials, and access. And while CEPI is coordinating global research and development of vaccines with an emphasis on equitable access. Access is a very key issue when it comes to vaccines. That a vaccine is developed doesn't necessarily translate that it will be available to those that need it the most. So through a structure called the ACT Accelerator, a mechanism through which CEPI is working with WHO and Gavi to ensure that vaccines are available to countries regardless of their ability to pay. Now, this is obviously work in progress, and we're all working together with Africa CDC, CEPI, and Gavi to ensure that when a vaccine becomes available, that Nigerians can have access to it. What can we do? The process of vaccine research and development is very rigorous, and one that as we work towards access, we also have to start thinking about investing in the science and developing the institutions that we will need into the future. But in the short term, we're working together with other colleagues around the continent through the Africa CDC in a consortium for COVID vaccine trials, clinical trials, to start advocating for some of these trials to be done on the continent with African institutions. To do this, we have to build capacity, gather sufficient data, and include African institutions in these efforts. Secondly, we have to start preparing the Nigerian population for vaccine delivery when it becomes available. Thankfully, we have a great national agency, the National Primary Healthcare Development Agency, with a very strong cold chain infrastructure, many years of experience in distributing vaccines across the country. They will be leading on the distribution and the thinking and the planning for this. But we must not take anti-vaccination campaigns for granted. There's always a small part of the population that resists vaccination for different reasons. So the time to start the risk communications about the benefits of these vaccines potentially is now. So these are emerging issues in the work that we do. As we progress towards the end of the year, the importance of this work will increase. As soon as some vaccines become available, our responsibility collectively in preparing Nigerians for the implementation of vaccination campaigns, in whatever form they will take, will become increasingly important. So it's important that we start thinking about this, engaging with the science, but also remaining a little bit circumspect, because none of these are absolutely guaranteed of success within the timelines I've stated above. But we have to remain optimistic and keep pushing so that we see that when these vaccines become available, we are prepared to deploy them as quickly as possible to our people. In the long term, our country should be more involved with the research and development and, of course, manufacturing. A lot of effort has already been made in this regard, but this is a wake-up call for all of us to do a lot more with the private sector, academia, and all the government institutions with a role to play around this. So we all look forward to emerging stories, emerging news on vaccine developments, engage actively with the Africa CDC that is leading our efforts on the continent to ensure that Nigerians have access to these vaccines when they do become available. Thank you very much.
The Secretary to the Government of the Federation and Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be talking to you briefly on the issue of reopening safely. As we're aware, a lot of state governments have gradually started to reopen their economies, but we'd like to remind everyone that COVID continues to be a silent threat to all of us, whether we are old or vulnerable, and also to our way of life. In Nigeria and in many parts of the world, it continues to be a silent enemy. And unlike other pandemics such as Ebola, for instance, we do not see dead bodies on the streets or in hospitals. Instead, it comes silently into our homes and claims our most vulnerable. Nevertheless, we cannot let our guard down. We need to protect our elderly and loved ones with pre-existing conditions who continue to be those most at risk. With the reopening of the economy, the PTF will continue to provide data-driven and scientific advisories that can protect us from this pandemic. So far, our data analysis shows that most Nigerians continue to be in denial of the dangerous nature of this virus. As our airspace and various sectors open up, it's really very easy to forget and be fooled into complacency, but we really shouldn't. We're urging everybody to always follow approved non-pharmaceutical advisories, such as the use of face masks all the time and properly, hand and respiratory hygiene, as well as physical distancing, in order to protect ourselves and our most vulnerable parts of the population. We can only win the fight against coronavirus when our knowledge of prevention translates to our daily behaviors at home, at our workplaces, our religious centers, and in fact, anywhere. We definitely must embrace this new reality, especially as the world continues to look for a permanent solution to the pandemic. The PTF would like to appeal to state governments and religious bodies to proactively prevent transmission of the virus by continuing to advocate and practice the approved preventive measures and guidelines. Specifically, we urge businesses that are reopening to align themselves to our efforts by establishing and practicing COVID-sensitive business precautionary measures. We eventually have to reopen, but we can only do so if we reopen safely. It is quite clear, as we can see from other parts of the world, that certain countries are now going back into lockdown states because of the pandemic coming back again. In other words, a recrudescence, what we call a second wave. We really cannot afford to have this happen in this country. It will destroy our economy and it will lead to a lot of deaths. Therefore, we have to reopen safely. We cannot risk another shutdown, nor can we risk having more lives being lost. I would like to also remind us all of the safety guidelines for the eased lockdown phase 2, which we are currently in, and this will continue to be in place until Thursday, the 6th of August, when we will announce the new protocols for the third phase. We cannot be tired of the virus because we know the virus is not tired. Finally, on behalf of the PTF, we'd like to thank all the state governments and religious leaders for working with us by communicating and enforcing those guidelines that will keep us safe, especially during the recently celebrated Salah. Thank you.
The chairman of the PTF, my colleagues, the national coordinator, the DG and CDC, distinguished ladies and gentlemen of the press, Eid Mubarak, and welcome back. I would like to just make some clarifications as a result of what is being dominated in the space these days. The COVID-19 pandemic was an unanticipated emergency, and the world was taken completely unawares. Nigeria was not different, and to tackle this pandemic, different measures were taken, and this presidential task force is one of such measures by the government. As a ministry tasked with providing humanitarian interventions, disaster mitigation, and social interventions, we quickly set up a technical working group to operationalize the efforts of the ministry and complement the efforts of the PTF. The intervention was to help the vulnerable members of our society cushion the economic effect of the pandemic through the provision of social safety nets while building resilience for the future post-COVID-19. In recent days, as I mentioned, there have been rumors and innuendos and speculations around one of our key interventions during the pandemic lockdown. and that is the National Homegrown School Feeding Program, which was modified and implemented in 3 states following a March 29th presidential directive, whereby we are directed to continue to provide meal to primary school through the Nigerian Governors Forum.
Jarabawa cikin natsuwa kuma ba tare da wani damuwa ba. Wannan tsaftacewan da feshi da ake yi yana kashe duk waɗansu ƙwayoyin cuta har da ita wannan ƙwayan zarran corona ɗin a wuraren. To wannan shine dalilin yin haka. A wannan gaban ne muke kira ga iyaye su ba yaransu shawara da su kasance masu jin magana, su kuma duk wani tsari ko umarni da za a ba su a wannan guri kamar yanda ma'aikatan ilimi suka gindaya domin tabbatar da cewa ba a samu wani abu na yaduwan wannan cuta a wannan guri ba. A ƙarshe muna musu fatan alheri kuma da fatan za su lashe dukkan jarabawan da za su zauna su ɗauka. Mun gode.
Well, please let's be mindful of the fact that we have to conclude this before the news bell rolls in. So make your questions short and direct. Thank you.
Good evening, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to direct my first question to the national coordinator of the PTF. It has to do with schools resuming for exit classes. Some states already, no, I think the national coordinator can respond to this. The Minister of Education has this on. It has to do with some states that are already directing that those who will be resuming to private schools, one of the conditions is that they must undergo the test for COVID-19, and they are paying a cost, 25,000 naira, for instance, in Ogun State. Is this approved by the PTF? That school children who are resuming, they should pay a cost for testing, like the one in Ogun State, 25,000 naira. The second question is related to that, and I would like the Minister of Education to respond to that. It has to do with the government schools. Information is already going around because it was sent in by a parent that parents should prepare to pay the 3rd term school fees as schools reopen. Is it also approved by the Ministry of Education that all students in government colleges should pay school fees, 3rd term school fees? Then the third question, I don't know, maybe the NCDC DG could respond to it, or the Minister of Health. What plans do we have, response plan this time, do we have in place to manage possible spike in the number of cases? I'm asking this question based on the fact that some countries that earlier resumed schools, we saw reports of spikes. And so it's not impossible if we are going to see that in the next few days as schools are reopening for exit classes. So what management strategy do we have in place as we speak so that if we experience that, it will not overburden the situation that we already have? And lastly, I would like to ask the NCDC DG also to respond to this. How many accredited private laboratories do we actually have now that can test for COVID-19? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is to the WHO rep. Sir, in this area of controversy of COVID-19 and let's say politicalization of this virus, how can WHO verify the reliability of the different trials of vaccine ongoing at the moment? My next question is for the SGF. Sir, following on from what the DG and CDC has said on the progress of vaccine around the world, what is the government of Nigeria doing to ensure Nigerians will have access to, one, if and when it's developed. Also, as we have spent time developing our labs capacity, as a result of this pandemic, what is being done to our research and development capacity to enable more internal industries play a part in developing our own research capabilities? Thank you, sir. And my last question is for the DG and CDC. Sir, Nigerians have observed decline in the numbers of daily positive cases in the past 2 days. Some Nigerians are already excited that we are beginning to flatten the curve. What's your opinion on this, please? And is it time for us to begin to talk about herd immunity? Also, how can we verify this and with science evidence, please, with scientific evidence? Many thanks.
Good evening, sirs. My name is Yemi Adebayo from AIT. My first question is to the Honorable Minister of State for Education. There are demands by private schools, private primary and secondary schools, for third-time school fees. I want to find out from you, does this have the go-ahead of the Federal Minister of Education to collect the fees even when the schools are not in section? Then my next question is to the National Coordinator. I want to find out from you, sir, how often do you meet with State Commissioner for Health? Perhaps the Honorable Minister of Health as well can also respond to this. I want to know how often you meet with the State Commissioner for Health, because a visit to some states in the past few weeks reveals that some residents in that state do not really believe that COVID-19 exists. Hardly would you see some people wear masks. I'm citing this example and I'm using Abia State as an example. in Abia State, I want to find out how often does the PTF meet with the leadership of this state to actually drive home this message you come on a daily basis to tell Nigerians of what is happening. Then the SDF, sir. Ogun State is still on lockdown on Saturdays and Sunday. I want to find out, is the protocol being used in Ogun State, is it different from what the PTF is using, or what's the coordination like between the PTF and some of these states who perhaps have separate policies and protocols? Thank you very much.
Good evening, sirs. My name is Juliana Taiwo Baloyen, Minister of Education. This is just a follow-up to the questions some of my colleagues have asked. Same on private schools. Some parents have reached out to ask government how they can address the problems they are facing. They are calling it a rip-off because some of them are being told to pay between 250,000 and 320 for exit students for only 1 month, instead of the 3.5 months they normally spend for third term. So they want to know how government can help them address that. Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question goes to the Minister of Health. So I had an opportunity over the weekend to really interact with some people who've actually, survived COVID-19. Let me use that word. And a lot of them have this belief that they cannot be reinfected. They believe they have some sort of antibodies that now make them not susceptible to COVID-19 again, because of course they've had it and they've survived. So I want to get your take on that from all the evidence that you've gotten so far. Someone who's actually survived COVID-19, can they be reinfected? That is the question. My next question goes to the DG of the NCDC. Now, sir, we are in the stage of community transmission in Nigeria, as we're seeing in other climes as well. Are we still carrying out contact tracing, looking at those who we've actually confirmed? If yes, how are we doing that? And how many contacts are we currently tracing? And still staying with you, DG, the last time you told us there was a website that was being developed to help our time as it concerns getting our results timely it's still a major challenge. Even going to the hospitals, the clinicians will tell you their main issue is, how long they have to hold the patient until their results are out. So where are we on that website? And finally, DG, still staying with you, a question just came in as I was sitting there. And he says, please direct this question to the DG of the NCDC. He says, Lagos State recently published update on COVID-19 on the 31st of July, stating that they have about 15,150 confirmed cases and total discharges 10,835. But the figures on the NCDC website is not reflecting this position. The question now, is the NCDC not updating or not collaborating with Lagos State, or why do we have this disparity? This might have its own impact as data is being collected for integrity's sake. Thank you.
Good evening, everyone. My name is Mitaire Ikbed. I report for the NTA. My question is for the DG of the NCDC. We are getting reports that some persons who reportedly died of COVID-19 are still being buried with big ceremonies and massive attendance of people with complete disregard for COVID-19 guidelines, especially in some parts of the Southeast. I want to ask if the NCDC is still monitoring such trends and if you are doing anything about it. Maybe you need to rehash the protocols for burial of victims of COVID-19 for guidance of the populace. And I want to also ask, at the time, as a follow-up to what my colleagues asked earlier, at a time when testing is increasing, we're witnessing positive cases going down. So are we flattening the curve as a people, or we are in the process of doing so? Thank you.
Thank you. We've taken all the questions. We'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State Education, and the country rep for WHO before we invite the chairman to wrap it up. We'll begin with the Honorable Minister of Health, please.
Thank you, everybody. The question is, I think, from Friday about the strategy for managing spikes. It's a very good question because the reports we have from different countries, and as you know, we are all observing all countries. Everybody is observing the other and seeing what they do and what works and what didn't work. And it has been observed that there is actually a spike when certain activities take place, like when you open schools or when you open transport system or you open the commerce, and some have been forced to shut down. But still, every country wants to reopen the economy and get things going. We talk about saving lives, but also saving livelihoods. People have to live. So that balance, that very delicate balance between saving lives and preserving livelihoods is what it's about with the PTF. And there is trying to get both at the same time. It's a very thin line. Now, the first thing to say about that is that the responsibility for managing spikes does not lie with government alone. It lies with everybody, with citizens, and with all the subnational governments. So you have a role to play in helping to enlighten the public, to allow the public to understand the needs that go along with reopening the economy. There are responsibilities and there are activities that will mitigate the harmful effects of reopening the economy. Specifically, we're looking at arrivals. There are arrivals that come from by air, usually from other countries, and some of them by land too, which we manage carefully. We are preparing for those arrivals if and when commercial air transport opens. We want to be able to do screening by taking usual port health screening and taking samples whether of arrivals at the airport, so that we can tell immediately those who have arrived carry the virus or not. The other one is what I just announced in my speech earlier, that we are trying to expand sample collection to rural areas, because you might not find a spike if it's in the rural area that is not being very well monitored. And there's reason to believe now that if we focus too much in cities and urban areas, we might miss what's going on in the small towns and urban areas. So we want to start also looking at those areas. That's why I've mentioned oxygen kiosks in local government areas and sample collection. All that is part of the strategy to start getting ready for what spike you might have, and this spike might not necessarily be in the city, it might be outside. Then the important one which I started with, which is the risk communication, where all of you sitting here today are all involved in risk communication, in education, in public, in community engagement. We were talking today about also trickling down the responsibility to community leaders, to the gatekeepers of the communities, religious leaders, political leaders, and traditional leaders, to help to domesticate the idea of non-pharmaceutical interventions and measures for the people to be more compliant. So we believe that if we are diligent in keeping to these prescriptions, the impact of gradually reopening the economy will be well mitigated. And we may be able to get away with reopening the economy and not seeing a spike, or seeing only a minimal spike. But let me say again that it's a responsibility for everybody, for all of us here in this room today. Now, the other question is the question of possible reinfection. Well, that's something that's still a matter of conversation and guesswork. If you can be reinfected twice, if you can be infected again. I think the WHO country representative will say something about that too. It is too early, because we've had COVID for only about 5 or 6 months, for us to really know. From what we have read, I have read that only about 60% of people who got COVID actually developed enough antibodies, which means that, in fact, not everybody who had COVID-19 infection actually got enough antibodies, and that the antibodies actually began to wane and deteriorate, and after, I think, 3 months or something like that, only about 17% still had significant antibodies. But I think the WHO rep will fill up on that one, because this information is constantly changing as we learn more and more about it, as researchers begin to publish their works more and more. The story changes or shifts this way or that way. So the question of building antibodies is what actually protects you from reinfection. And if it is said that 60% build sufficient antibodies, well, nothing was said about the remaining 40%. So it's something that I believe science will eventually show, or those who have seen what the latest information is will also guide us. And if the antibody titer began to wane, to reduce after some months, then that is not very good news. But as I said, the information is constantly changing, getting more and more accurate as more research results begin to emerge. Thank you.
So thank you very much. I think the Honourable Minister has answered the question on spikes, but just to say that, as we respond to this outbreak and build up our health security architecture across the country, these cases will, even for the next few months, even when we get a vaccine, we have to always be prepared for spikes and respond to it. And that's why we're working with state public health teams to really raise their capabilities. every state will now have, from the experience of this outbreak, a rapid response team. Hopefully we can have the funding to support health security in the long term, and that is really what will keep us safe. And all this has to happen every year before we have an outbreak, not during an outbreak. So really the investments that have to go into health security to keep this country safe at the federal and state level will be a political choice for every state and at the national level. So we are learning at the national level the investments that have to go into this, and these lessons will have to be learned at the state level in the short and in the long term. In terms of labs, private labs, we have 7 labs testing privately now in Lagos, 2 in Port Harcourt, and 2 are in the final stages of accreditation in Abuja. We're encouraging private sector labs to take on this responsibility. In Lagos, they have negotiated a rate to charge the public sector that want to go to test in a private lab, so they're negotiated rates. We believe that as more labs come in, we will drive down these prices of private sector testing, so that people that want to test because they want to start work or whatever other reason, they can go to the private labs and test, and we can keep the public sector labs for public sector testing. And so we're actually encouraging private sector labs. We've put up the guidelines, made the process very simple through an online process with the Medical Laboratory Science Council of Nigeria and the state governments, because state governments are responsible for accrediting labs altogether. We've made the process very simple, so we're actually encouraging labs to go on and take on this responsibility. There are a few other private sector labs that are testing on behalf of the public sector through arrangements with the states across the country. In Kaduna, we have DNA labs. In Imo State, Everbright. In Anambra, Kunalysis. Those have negotiated rates on which they are testing on behalf of the public sector as we build up the public sector labs. There was a question on the decline in the cases in the last few days. We all know we've had a long weekend. We've had an excellent Salah break. I hope you've all enjoyed your break. Many of us didn't have one, but it was still good to slow down a little bit. And that slowdown has also happened that many of those collecting samples across many states in Nigeria have also slowed down. Yesterday we had the lowest number of samples collected for many months. But we understand, because we have been at this for 6 months. There's a bit of fatigue, but just like my brother Sani just said, the virus is not tired. So we have to kind of find the energy to keep our spirits up, keep our determination up, and keep doing what we need to do until we get to the point of vaccines, like I said earlier. So please don't overinterpret the reduction in cases over the last few days. Our curve is not looking too bad, but remember it's a big country. Yeah? The curves are different in the different states and mean different things as well. But we're not in a worst case scenario by any means. Earlier in the year, some of the projections were really for an explosion of cases across the country. We haven't seen that happen, but we are not out of the woods yet. Our numbers are still what they are, like you know. So yes, our curve is not looking too bad, but it's not yet time to celebrate by any means. On contact tracing, right now we're following, I just looked at the data, about 11,000 contacts nationwide. You see, when we talk about community transmission, the intensity of transmission in somewhere like Lagos and FCT is different than in other states where you have a handful of cases every day. So where you have fewer cases, you can really pay a lot more attention to contact tracing because your cases are fewer. Where you are somewhere like Lagos, and you have, over the last few months, 100 to 150 new cases every single day, it becomes a little bit more difficult to do in-depth contact tracing for each of them. So really, this is about the capacity in every state vis-a-vis the number of cases that they have. So our guidance is never to stop contact tracing, but we understand that as cases increase in any state, they cannot follow every single case in the level of detail just because the number of people to do it become stretched. But once the curve starts coming down again, they're able to do it, and then they increase their work around it. So that's really the calibration that we propose for contact tracing work. The platform on electronic results has started already. So this is not a website where you can go and check. When you are tested, you will get a text message. So that is already happening in Abuja right now for everybody in FCT. Once their results are loaded onto the platform, they get a text message to check their results. They are given a code so that in case that text message gets lost, so they put in the code and then they get their result. If they want to print it out, they go onto the online website and print it out using the code that has been generated for them. It's a unique code just for that individual. So right now, if any of you has a reason to get tested, you will get your result in that through that platform if you're tested within the Federal Capital Territory. If that works well, we will start offering it to other states to implement in their own states. The discrepancy in the number of discharges from Lagos is really one. Over the last few days, we had to come up with a criteria for discharging community cases. So cases that were found positive, that were not ill, and were never brought into care and managed in the community. So they weren't brought into hospital. So we defined a new discharge criteria for people like that. And Lagos had started implementing this, and they have just told us, so we will synchronize those numbers by the end of today. So this is really how do you respond to a backlog of cases who from the beginning of the outbreak were positive, remained in the community, and therefore we couldn't say we have discharged them in the normal sense of discharge from hospital because they were not brought into hospital in the first place. So we now came up with a strategy to do that, which they have now implemented, and we will now synchronize our data. So it's actually an example of collaboration and not conflict. And finally, Mitari, I think your question on burials. The guidelines of the Presidential Task Force are the same. Implementation is really a responsibility of the states to manage. Burials are not an easy thing to police using law enforcement. So we continue to encourage people across the country. We understand the sensitivity and importance of funerals. In almost every culture in Nigeria, it's important to give the final rites to our dead. But, the rest of us have to find a way of staying alive. And the only way we can stay alive, really, is to observe those. And funerals are actually a place where, because of the emotions, it's very easy to forget those principles that we offer. So the guidelines are the same. We're encouraging people to limit it to 20. And even within those 20, to observe all the physical distancing, face masks that are necessary. In many parts of the country, especially in the south and the southeast, there's been a backlog of funerals because of the restriction on travel. And in fact, across the country. So once the restrictions were lifted, you have this backlog of funerals that are now happening almost every weekend. And we understand why that is necessary. And ultimately, we need to say bye to our bereaved. But really, in doing this, we have to stay safe. And we have very clear guidelines on our website for what we call a safe and dignified burial. We always add the term dignified because it's important that even in these difficult circumstances, we recognize the importance of at least managing as much as we can to carry out a dignified burial. Thank you.
We'll take the national coordinator.
I think I had only two questions. The first one had to do with the issue of paying costs by students for testing for COVID. So our protocol is very clear when it comes to the indications for testing. And it's also important to realize that when you do a COVID test, if you get a negative result, it's only valid for that period of time for that point in time when you had the swab taken. So the next day you could have a positive result, especially if you are in an incubation period. Therefore, the validity of a negative test is quite limited. It's far more important to monitor for symptoms, to check for temperature, to make sure students that have symptoms of a cough or any other respiratory symptom are told to stay back at home and seek medical attention. It would be far more useful than doing a COVID test before they resume. And it would be safer as well. So in other words, monitor the students rather than testing them at a particular point in time. Secondly, how frequently do we meet with the commissioners of health? Well, actually, we have pretty strong engagement with the state governments. In fact, we have a representative of the Nigeria Governors Forum embedded within the PTF pillar structure. We have met virtually with commissioners of health on various occasions. More recently, we had a meeting with selected commissioners of health from the states that we call the hotspot states, 4 of them that have a relatively high burden. I know the Honorable Minister of Health meets frequently with the state commissioners of health. In fact, with Lagos, I speak to the Lagos Commissioner of Health at least once a week. We have fortnightly meetings with the subcommittee of the Nigeria Governors Forum. So there's clearly a lot of engagement and interaction at the state level. I think what is happening when it comes to issues of disbelief about COVID or a reluctance to follow the non-pharmaceutical interventions we recommend is more to do with the messaging and also more to do with the nature of the illness itself. As I said earlier on, unlike other pandemics with COVID infection, the majority of people will continue to be relatively well. So pushing out that message that it's not really the young ones that will be an issue, it's really the elderly, those with comorbidities. And when we protect ourselves, we are also protecting our loved ones that could be put in a very vulnerable situation and could potentially die from this infection. But as far as the PTF is concerned, we continue to engage very closely with the state governments, and we have a very healthy relationship. Thank you.
We'll take the country rep for WHO before we take the Honorable Minister of State Education.
Thank you for the question. The first question was about the means WHO has to validate the result of clinical trial on vaccines. What I can say about that is, if you remember when the WHO declared the COVID-19 as a public health emergency of international concern, it launched a global response plan, which was framed around 3 objectives. The first one was to coordinate international response. The second one was to develop guidelines for countries to develop their own preparedness and response plan. And the third one was about streamlining research and development. It's in that context that some initiatives were launched, including the initiative to start research into vaccines. Ever since, there was a group of researchers that were invited in Geneva to start reflecting on possible ways, possible avenue with respect to potential candidate vaccines. And several groups registered for clinical trials. So it's in that context that many of these clinical trials are ongoing. Now, when the result will come, WHO, as I said it last meeting we had here, WHO has a strategic advisory group of experts on vaccine and immunization. It's that group that reviews the evidence. They look at the safety of the candidate vaccines. They look at the efficacy. They look at the effectiveness and many other parameters. They judge the weight of evidence to know whether it's credible or not. It's based on strict criteria that group can judge that this vaccine is effective, can be rolled out or not. And usually the criteria that is used is to make sure that based on the evidence presented, that vaccine can protect at least 60% of the people that were vaccinated, usually compared to a placebo or another group of interventions. So that's how WHO judges, and it's a very strict, rigorous procedure before WHO could recommend a vaccine for wide-scale use. The second component is just a complement to what Honorable Minister of Health was talking about. What happened when somebody has been infected, survived COVID, in terms of whether the person could be reinfected or get sick again. As the minister said, this is a new disease. We are learning every day. The preliminary evidence suggests that normally if you get infected, you develop some kind of protection or immunity. But the first preliminary evidence suggests that immunity does not last long. It's just about 3 months or so, and then it wanes. But then we have two types of mechanism of defense. So we have that defense that depend on some chemicals that individual produces when it gets reinfected, the antibodies. Those ones do not last longer. But we also have the memory, the type of defense we use when the virus gets to the cells and those cells get destroyed. That type of memory, some studies suggest that it may be there even though the mechanism used by the chemicals might wane within 3 months. But as the minister said, we are still learning, so we don't have a definitive answer. And surely, by sometime, over the next weeks or months or so, we might get answers through evidence that's coming in. Every day, there are hundreds of publications on what is being discovered with this coronavirus. Thank you.
Good evening, everybody. Now to say schools essentially open at the moment for exit classes. They've already commenced, some of them today. I monitored some of the developments around Lagos State, who's been open. Some other states will open as the week proceeds. The federal government colleges will begin in the morning from tomorrow to take into them. But the questions that you've asked revolve around what this plan is, whether it is adequate or is proper for people to charge fees for a third term. Now, we did communicate last week before we went on the break that really, once this WAEC exam starts on the 17th of August, it will run through to the middle of September. We will immediately thereafter commence NABTEB. NABTEB exams are national business and technical examinations, which also qualify you to go to universities with. It's not just WAEC. And that exam will run into October. About a week to its end, we will begin NACO exams on that will be the 10th of October, and that will run through to November. So for all of this period, we expect that children are working, they're examining, and they're learning. We don't just want them to be in the schools and be playing. This is serious stuff. This is exit class. This is what's called, says a lot about the 6 years you've spent in that secondary school. So we believe that even right now, we are leaving the registrations for NAPTEB and NECO continuously running, even while we are about to begin WAEC, because we know that the WAEC results are not expected till way after November. So you probably may have to take these 3 exams. But more importantly is all WAEC and all exams are a test of outcomes. We want to know what it is you've learned over the years. So we want our teachers to continuously engage them. And that is why in my Zoom meeting today with all the commissioners of education around Nigeria, I met with them at 11 o'clock. Fortunately for us, for a place like Lagos that was reopening today, for Madam Falashade, the commissioner for education there, was going around the schools to see and put them on Zoom to show us what exactly how we've distanced the classes. Many of them will not be more than 20 in a class. It's for a huge school that can take 1,000 and you bring in 200 people, they just be swimming around the school. That's exactly what we wanted to achieve. We want to achieve those kind of social distance. And we spoke with the principal of QC in Lagos, and she, on behalf of the other principals, explained how they've met with them. From tomorrow as well, myself, the officials of the Ministry of Education will be touring the federal government colleges around the country, because we're going to be using all the directors, because when we finish the monitoring, we will evaluate the state of preparedness and what gaps that need to, you may notice from what the NCs pointed out, we didn't demand testing because we are aware that the results show that your positive test is only as good as tomorrow. So the important thing is with the regime that we've imposed in the schools: hand washing, early detection, mask wearing, making sure everybody's clean, making sure everywhere is distanced, all of the protocols that have been asked to establish. We've established all of them, and we're going to be evaluating them rapidly and be able to be present and be able to react as soon as we can, and making sure that everybody is on their toes. That's why we're almost monitoring them on a rapid basis. Now, you're also going to be asked, I would like to answer what private institutions may want to charge. Really, for government institutions, we can't tell you that we charge school fees. Most of our schools are free. Public schools are free. So I don't know, it varies from state to state. But when you go into a contractual relationship with a school owner is a passionate person, but is also a business person. They're not running a charity organization. They may be charitable in their approach, but it's not a charity. So it is important that you appreciate that a private school is entitled to charge fees for the work they do. The person that runs the school, or the proprietor or proprietress, may in actual fact be a very passionate person about education. But I'm sure they are not going to make provisions with their broad. They are going to be charging you for it. Now, for the places where we control, which are public, essentially there may be some sort of assistance that comes from the states that own them, because the majority of these schools that are public are owned by states. And those states are making a lot of effort. On Saturday, I was on a Zoom meeting with Anambra State Education Authority, and they have gone to all kinds of lengths to make sure that they are providing for their people. Even Yobe was telling us this morning that they are ready. They've distributed wash hand pads. They've done it. People have gone. State governors have done a lot. Professor Zulum, who is an education and a governor in the state, has already proactively procured all of the things that were needed. So a lot of states have made that effort, and we encourage them to continue to engage. However, it will be it actually is not in our place to demand that kind of compliance with private institutions, because they provide for the things there. If there are any ways we can assist them, we will. If there are compassionate manner with which you can approach them to become a little bit more charitable with the engagements that they may offer parents, then that is also acceptable. However, that is not within the purview of the local of this PTF. Thank you very much.
Thank you. I will now invite the chairman of the PTF to the podium.
I'm not sure there's anything to answer. All the questions have been taken, but just for the purposes of emphasis, I think that there was a question that dealt with the issue of research. Rachel, you are the one that asked about that question. What about research, the capacity and all that kind of thing. I think we've done tremendously well in that area. About 2 weeks ago, I did inform you that I was at the Central Bank of Nigeria, where I inaugurated, on behalf of government, the body of experts drawn from all over the country, people that have been involved in research work and also all in an attempt to build capacity and build institutions, pushing the agenda of developing a homegrown cure or vaccine for COVID-19. And I believe in the process because a lot of money is being committed to that. I'm not very sure, but something around the margin of about 26 billion is what the central bank is putting out there for the purposes of pushing this particular agenda. I believe that post-COVID-19, our infrastructure for research would have been solidly established. And even before this particular committee that is chaired, a body of experts that is chaired by the DG of NAFDAC was inaugurated, so much of interventions were put in place by the central bank, 100 billion to the health infrastructure facility that was made available for pharmaceutical companies and hospitals and big health institutions to draw from. One, to address the very negative impact of COVID, but two, to help them also re-strategize and build capacity for the production of medicaments and all the things that are required in our national response. So I think we're doing pretty well. There was a question that had to deal with vaccines and how, I think it was, you were the same person that asked about that, how to deal, or was it the AIT chap that asked about that, how to deal with the issue of vaccines. How do we ensure that Nigeria as a nation is not in any way shortchanging the processes of acquisition of the vaccine? If you follow in the international media, it's a highly complex and competitive thing. China is pushing its own agenda for the development of its vaccine. Israel is doing the same thing. France and the European Union countries are doing the same thing. Britain, the United Kingdom is also pushing its agenda for the development of vaccine. Russia has put it out there in the media space that probably before the end of this year, they will begin to administer vaccine to their people. And so much of financial commitments are going into that, but I think the country rep of WHO had alluded to that, that we are signing on to different arrangements as a nation so that we do not lose out when vaccine is eventually developed, is tested, and is confirmed to be ready for use on human beings. They are in different stages of trials, but I believe that with the current involvement in of Nigeria in different platforms, we will definitely position ourselves in such a situation that when vaccines are made available, there is an equitable processes of its distribution so that the big boys do not corner everything. The world population is about 7 billion or thereabout. To produce vials of vaccines to meet the need of 7 billion people, it's a lot of work and it's a lot of resources that will be committed. But one thing that we are trying to do is to make sure that there will be some form of equitable distribution of those vaccines so that even developing countries and countries that do not have the financial capacity to acquire these vaccines would be programmed in such a way that in the processes of the distribution, they also will be able to access the vaccines. And knowing fully well, even with the eradication of polio and other health challenges that we've had in this country, not everybody gets the vaccine in one day. It's a program application of the vaccine that has continued over the years. And I think with COVID-19, it will be the same thing. Not everybody would have access to the vaccine at the same time. This will be left for our health institutions to determine who are the ones that are the most in need of the vaccine. So there will be a systematic processes of its distribution. There was a question from you too about the issues of lockdown with Ogun State. When we started as a presidential task force and we designed the national response, we were quite oblivious of we were not oblivious of the fact that we ran a federation. And what that presupposes is that the subnationals have some latitude of variation of the response and the protocols that we were putting in place. And we did encourage ownership of those protocols so that they can modify it to suit their prevailing circumstances. Typical example, it's been 2 months now when at the national level we have given the leverage of opening up places of worship. The last 2 months, Lagos has not opened that up. They are just going to start it on the 7th, this Friday, and thereafter on Sunday with church services. 2 months after, as a national response, we ease down on places of worship. But Lagos as a state, as a subnational, decided that, look, they had even announced a date when they were going to open. But when their figures began to spike, reasonable for somebody who has the interest of his state to say, look, slow down, let's calm down. I mean, let's not push so hard. And just because the national response says ease down, they took their time and began to engage with the different religious groups until finally now they have decided that, okay, it's right for us to open. We've put in place what we need to put in place to ensure that that happens. And I believe it is in the same vein that Ogun State might have applied some certain variations to what is permissible, to what they can do, all in an attempt to obstruct the community transmission that is taking place in their various communities. And because of the proximity of Ogun and Lagos, you cannot really separate them in terms of geography. A lot of people live in Lagos but work in Ogun. Same way, a lot of people live in Ogun but they work in Lagos. So there are a lot of things that the heads of those subnationals have taken into consideration before implanting some of the policies that they have implanted. But I believe all is an attempt to provide for their people, protect their people, and try as much as possible to interrupt the community transmission that is going on. Let me finally conclude by saying that, yes, we've gotten to where we have gotten today. And I did refer to it in my paragraph just to underpin the virulent and the potent nature of COVID-19 as it still is ravaging the entire world. When I mentioned in paragraph 5 of my statement this evening that on August 2nd, the cumulative world global cases went up to 18.2 million with almost 700,000 deaths. Look at the exponential growth or increase in the figure. Within 4 days, starting from the 29th of July to the 2nd of August, we had over 1 million infections worldwide. And we've always said this, that for Nigeria, our statistics has always been underpinned by the fact that for every one infection, we believe that there are between 6 and 7 other infections that we have missed in terms of capturing. Just do a simple arithmetic of multiplying those figures. You will know that the number of infections, particularly in our own client. Yes, officially this is what we are reporting. But if we work on the presumption that, or on the assumption that for every one infection, we might have missed 6 to 7 other infections, you will know the figure that we are dealing with. And it just gives me a great concern. You have all observed it. You make references of Abia or any other state that you have visited in the last week or two after the ease on movement. And you are reporting yourself that there doesn't seem to be a greater understanding of the perception of the risk. Here in Abuja, the perception of the risk is extremely low, in spite of what we have collectively, us on this side and you, that have been broadcasting the need for our compliance with the pharmaceutical interventions. If you look at the way people behave, I get the feeling that we've gone to a point when probably Nigerians are beginning to say, okay, COVID-19 is here to live with us. So let's just allow ourselves romance COVID-19. Those that will survive, will survive. And those that would fall victims, will fall victims. But I don't want to discourage us. I don't want to discourage you. We have a duty to this country. We have a duty to our generation to continue to drive this message that we have a responsibility to take personal responsibility to ensure that our people around us comply with the non-pharmaceutical measures that have been put in place. Because so far, that is the only known cure. That is the only known cure. Our president is given the purposeful leadership that is deserved. We say wear a mask when in public places. When he was stepping out of the villa to go to any place, to Bamako, Mali, he wore a mask. When he turned up at the Eid prayer ground within the villa, not even outside the villa, he wore a mask. That's giving purposeful leadership that I expect all the heads of the subnationals to take a cue from and lead by example. And that's the only way. When our people see people in places of leadership leading by example, then it becomes easier for followers to want to emulate them. COVID-19 is no respecter of persons, of creed, of status. When it comes to ravage, it ravages whoever is standing at the point that it releases its very virulent nature upon. So the message for today, as far as I'm concerned, is that we can't give up. You went home, you went to different states, you saw the real non-compliance. I've driven around Abuja, I've seen the level of non-compliance. And like I said, probably we've just given up. Our people have just given up and come to the conscious realization that COVID-19 will be here for a while. So let's just continue with the romance and enjoy ourselves. And whatever happens, we'll face the consequences. But the truth about it is that that would account for irresponsibility if you do not take responsibility, because your actions would affect other people. That's the danger about it. If it is just for yourself, we'll say, okay, that's your choice. But your actions or non-action would affect other people. And that's why we must keep emphasizing that our people have a duty to themselves, to their loved ones, to the community, to the nation, to observe the non-pharmaceutical interventions. And as we do that, God will help us get to the top of the curve, flatten it, and as we await the production of vaccines or the discovery of any form of cure. Thank you, and have a good evening.
Thank you very much, Chairman PTF on COVID-19. We have effectively come to the end of today's national briefing. We still have a take-home. We must not give up, no matter what the situation is. COVID-19 could be with us for a very long time. Let us remain vigilant and careful, because we are still in the middle of a pandemic. And while the world awaits the vaccine, which is still a long way ahead, we all have roles to play and steps to take. Avoid infection at all costs. Comply with the measures. Stay safe. And make sure that you protect your loved ones. Well, we have been told that the 1 million cases jump in the global figures in 4 days. It's a stark reminder that the virus is still very active and it never gets tired. Please bear this in mind at all times. The economy is reopening. We all have a responsibility. That doesn't mean that COVID-19 is gone. We have a responsibility to ensure that we mitigate the impact of the reopening, because we are balancing lives and livelihood. Risk communication is our joint effort. Community engagement is our joint effort. Whether you are a religious leader, a community leader, a traditional leader, a family leader, please play your role and ensure that you communicate effectively, you educate everybody. Well, finally, if you have survived COVID-19, come out and tell your story. There's nothing like stigmatization. Let's eschew it. Let's eschew fear. However, knowing that COVID-19 is work in progress in terms of the studies, avoid reinfection. Do not take risk. I thank you very much. God bless Nigeria. We hope to see you on Thursday.